A very good evening to everyone. Welcome for joining me, Vance, your host for today. And this is Kopi with Vance. Okay, I'm pointing here. Okay. As usual, before we start, and the signature and the mark, of course, the mark. And okay, today's not coffee, it's water. I have to declare. All right, so we're coming back to the topic again. This week we are going to bring another doctor in. He's a surgeon. He's an orthopedic. Of course, obviously, we know that we have also set up our posters up, which is prevention and purpose. As I host together with myself with Dr. Hitendra K. Doshi, specialist orthopedic surgeon, and he is operating in HK Doshi Orthopaedic Center. And recently, he also opened up his third center, which I will get him on top later to do his introduction. But before we even go in to the topic itself, today I'm going to just talk a little bit on the bone, which also very interests me all the time, right? There's about 206 bones in the human body: the skull, the spine, the chest, and the arms, all right? I'll leave that to Dr. Hitendra to come and explain more on that. But it's a very interesting part of our human body that always we look at, right? We want to be fitter, we want to be stronger, we want that muscle, we want to be fat free or less fat, we got all kind of goals. But I think one of the most important and the fundamental is to understand about bone health. All right, sometimes it can be a calcium deficiency, or you become bone brittle, or after a certain age like menopause and so on and so forth, right? The calcium intake will be lesser, or maybe you will be intolerance or with milk and so on and so forth. So we're going to get doctor on board. I think he's already ready and ready to jump in. We're going to have a lot of discussion today, and in this discussion, of course, the last 15 minutes we will have our normal Q&A, which is of course welcome to all viewers to ask us question. So without any ado, I'm going to pull Dr. Hitendra K. Doshi up with me. Hello, doctor.
Hi, Vanan. How are you?
I'm good, sir. How are you?
Good. Yourself?
You're looking smart today.
How have you been? Good.
Good, sir. I'm good. Thank you for joining with me again. I do remember that during the pandemic, you came in once last year and give a very excellent presentation on bone health. And this year you are back again. Thank you, sir.
Welcome.
So, doctor, again, we are going on a different topic today. Of course, it's prevention and to overtake cure. I know we have a great PowerPoint today to talk about. Before that, do you want to do a short introduction about yourself, doctor?
Yes, so basically, I'm Dr. H.K. Doshi, and I'm an orthopedic surgeon by profession. And basically, I deal with a lot of musculoskeletal problems and also fractures and degenerative problems. So I think, first of all, I want to thank you for this invitation to be here and to share on a topic which I think is basically the way forward to ensure good health and happiness, which is to try and practice prevention.
Thank you,
And
doctor.
basically, it's preventing injuries.
And we also know that you currently have three locations, and previously you just branched out into your third one. So maybe you want to tell us to all the viewers where is your third clinic is now?
Basically, I mean, I'm in Glen Eagles and also in Parkway East, but I've also started another location to see patients at Mount Alvania.
Okay, so your third location is in Mount Alvania. Thank you, doctor, for joining us back again on the second time on second year, which is our anniversary for Kopi events. Shall we jump into the topic itself?
Sure. Let's start.
All right, doctor. So this is the first slide that we are looking at.
Right. Okay. So basically, as I mentioned, I think you see, many of us end up with some kind of injury, and then we are actually troubled with some amount of pain and symptoms, which then affects our day-to-day activity. So I think it's important to understand that a lot of these issues, which quite commonly happen, they're actually preventable to a large extent. And I think that is what we want to discuss here today, uh, to give some examples and to understand better what does prevention really mean and what's its main purpose as far as the orthopedic concerns that we're going to talk about. So that's basically the way forward. Now,
Right.
now, if you let's share some quotations. Like Bill Gates himself says, treatment without prevention is simply unsustainable. So, I mean, you can keep treating people for various problems, but if you don't prevent the problem, then it's going to be a recurring issue, and you're going to see more and more people suffering from that problem. Okay. So, another quotation that I would like to share is, if you move on to the next slide. Um, Even in the medical practice itself, Florence Nightingale said that the very first requirement in a hospital is that we should do the sick no harm. So at every stage, even while treating someone in a hospital, sometimes you can get complications. So again, the aspect of prevention is again there. For example, if you have a patient lying in the bed for a couple of days, they're bound to get other issues like bed sores, urine infection, chest infection. So even these complications, if they're not uh, uh, looked at carefully and you don't do certain things to prevent these problems, such problems can happen. So I think at every angle, at every aspect, uh, there's always bound to be have some repercussions. So prevention is, I think, something which we should all keep in mind, because it is something that has to be practiced throughout all ages, in all aspects, whether it's just about physical well-being or emotional well-being or even mental well-being, social well-being. There's always should be this preventive approach in our day-to-day life. Okay, so if you see the next slide again, moving forward. Now, I think the goal here is to maintain joint mobility and function. And I think that is what we all are here for, because, as we grow older, we have different demands in life, different responsibilities. But if our joints begin to fail us, whether it's due to chronic pain, acute pain, then we'll find that the quality of life is getting affected. You can't do the things you want to do, and you're in constant pain. So this is going to be a very important uh, element. All right. So, Vanan, if you can go back to the slide.
Okay.
Now, this basically boils down to an individual responsibility, because we are pretty much in charge of our body. And the moment we have an issue, we should look into the issue and try to arrest the problem. That is why I always advocate early diagnosis. Whenever there is pain which is persistent, you should get an early diagnosis so that you can prevent further deterioration. Again, the term or the emphasis here is on prevention. Second thing is lifestyle. Many of us have a particular lifestyle which may or may not be suitable for our body habitus, or we may have had a certain injury in the past, and because of our lifestyle, it is constantly causing a problem to the particular joint. For example, let's say we have an underlying knee injury and there is some meniscus tear in the past, which is already healing up, but it's still giving you some on and off pain, and you're developing a bit of arthritis. Now, if you choose to keep jogging, running, jumping, uh, and not keeping our weight under control, then you're actually putting a lot of undue stresses on the knee, and inevitably you're going to allow the process of degeneration to get so severe that you may end up requiring a knee replacement at your later years. So this is a classic example of how, uh, if you change your lifestyle, if you choose the correct kind of sport, having understood the underlying issue of concern, you can actually retard the rate of deterioration and prevent uh, your knees from becoming so arthritic that you become uh, so much in pain, and your quality of life becomes so bad that you ultimately require knee surgery. So this is how prevention from a personal point of view, where you have to be responsible, and you have to understand the lifestyle that you're living and whether you need to adapt and modify as you age, right? Now, move on to the next slide. So you can see here, whether you're young or old, through the years, there has to be some amount of adaptation. The slide earlier classically showed two people of different ages on a cycle. So you can be a young child on a cycle going very fast and being able to do a lot of stunts. As you grow old, you can still ride the bicycle, but you may have to ride it more carefully, more slowly, in a terrain which is less vulnerable to injuries. So this is just an analogy of how we should adapt, because this is again a very fundamental principle in preventing problems. Now, as I mentioned earlier in that example, now knees especially, they are a big issue to many people. Nowadays, you see a lot of issues, even in the young, in the middle age, and of course the elderly. They have a lot of knee-related problems. Sometimes people just after a run, after a tennis game, they have some knee pain, and a lot of the times it is due to overloading and overstressing it in an odd position, which can result in some kind of injury. So here, another very important aspect of preventing problems is to reduce the load on the knee. So this is where I think it would be very valuable to see a nutritionist or a dietitian to guide us on what is the correct uh, food that we should take to ensure that our BMI is within our normal limits, so that you don't overload the knees and have undue issues resulting from degeneration. All right. Now, if you move on to the next slide, now, of course, food again is a big contributing factor, and this is where I was referring to lifestyle, our likes and dislikes. So a lot of it is again mind over matter, and to be able to do this, you have to have the conviction, you have to have the determination to pick and choose the correct kind of food to prevent problems. Now, this is not just related to orthopedics. When you come to food, I think many people are nowadays having high cholesterol, hypertension, diabetes, even starting at an earlier age. A lot of them are also having obesity issues, and this can lead on to many other problems. So here again, to prevent all these problems, we have to get the diet right from the start go. It's very hard to undo our habits when we are 70 or 80 years old. But if you start from a younger age, then you'll be able to get it right from the start. Now, let me just go through all the slides one, and then we can have a discussion. Yeah.
Okay, sure, we do that.
So the next slide, exercise. Now, many of us again these days, we are often weekend warriors. We don't exercise or do any kind of activities from Monday to Friday, and over the weekend we decide to go to the field, we play cricket, or we are in the football field for 3 hours. And these are the people who will be most vulnerable to injuries, because you've not done exercise on a regular basis, and your tendons and your muscles are not accustomed to having a sudden amount of strain for a prolonged period of time. And that is what we call weekend warriors, and many of these people end up with a muscle tear or a ligament injury. Therefore, again, if you ask yourself, is this preventable? Of course it is, because if you're going to plan for a particular game over the weekend where you know that you're going to exhaust yourself, you're going to play more than what your body can take, then you should prepare yourself for that. Ensure that you do regular exercise, stretches, so that you prevent the problem, right? And of course, on the other hand, regular exercises, again, especially for the knee joints, are again very important, because if your muscles are strong, it'll keep your knees in a better state in terms of stability, and therefore injuries will be less likely. Besides that, exercise also promotes healthier bone, makes your bone stronger. And as you know, these days, many people have the issue of osteoporosis, especially when they grow older. And because of this, their bones are very brittle. And if they fall, they succumb to a very bad fracture. So again, exercise here is very important to maintain good strength of the bone, and this can help prevent osteopenia and osteoporosis. Now, next slide, Anand. Now, this is again another aspect of prevention. I see many patients sometimes who have got some issues with the ankle, for example, in the past. They've injured the ankle and they feel the ankle is a little wobbly, but they're still playing tennis, squash, badminton without any functional aids. So I tell them that if you already know that there is a certain amount of an issue, uh, it's sometimes valuable to have some kind of a support, especially when you are getting involved in a very strenuous activity and you know that your ankle or your knee or your elbow can be vulnerable to injuries during that period of time. So you should put on some kind of a brace or a guard to protect that particular joint so that it does not succumb to an injury. So again, this is avoidable. Many of these things are preventable. Now, next slide, Warren. Now, physio again is something many people don't see the importance of it, but I must tell you that a lot of my patients, I usually send them for physiotherapy, and many of them come back with much improvement, because we have to understand that a joint is always supported by muscles, and to have good stability and good mobility, the muscles supporting the joint has to be strong. Often, what happens is when you have pain, you don't use the joint much. You tend to offload it subconsciously. For example, if your left knee is paining and you are trying to walk or climb stairs, you would invariably put more load on the right compared to the left because your left leg is painful. And this will then lead on to more muscle wasting because you're not using the left leg. And when the muscles become weaker, the knee is more unstable, and this will cause more pain. And then when you have more pain, again you will tend to load it even less, so it becomes a vicious cycle. So to break this vicious cycle, you have to do a lot of physio. That is why going to a therapist or learning some simple physiotherapy techniques are very, very important. You can even do it at home. I'm sure as a fitness coach, Vanan, you would see this as a common issue where people are attempting to carry weights or do something, but because their muscles are weak, they're not able to endure that kind of training program. So probably you can tell us more on your aspect later as to how this is a very important element in preventing problems, right? Now you can see all the benefits of physio here. They increase your range of motion, increase strength, they will tend to correct your posture. Sometimes even people have a lot of neck pain and back pain because we're all the time on the computers. A lot of us have a sedentary job where we are sitting for hours and hours, especially now during the COVID period. Many of us are working from home and our ergonomics may not be right, our posture may not be right. And this has led to many issues in many people. So, again, are these preventable? Yes, they are. So, if you have the right understanding, you have the right technique, you have the right sitting posture, for example. All these issues of neck pain, back pain are definitely preventable. All right. So next slide one. Now, this is something that I have shared many times. It's to wear the cap number 7 whenever you're in a sports field. So you should always increase muscle strength, increase your flexibility, ensure you are playing the game with a proper technique. That's why sometimes you need a trainer, you need a coach. Simple things like how you hold the tennis racket or how you hold a badminton racket, the way you position your wrist, how you should take a backstroke. These are little things that become very crucial, especially when you're in a competitive mode and you're going to be playing quite vigorously. Use the correct gear, always play safe, follow the rules, and keep yourself hydrated. Many of us don't take enough fluids, enough water, and you tend to get dehydrated. When you're dehydrated, you tend to succumb yourself to injuries because you feel weak and you just feel very dehydrated after a game, especially towards the end. That's when you may tend to miss a step, take the wrong step forward, and then you tend to fall and then you injure yourself. And of course, whenever there is pain, I always tell people, if the pain is persistent, stop. You must stop and address the issue of concern. Don't ignore the pain and keep playing. And then it becomes to an extent where it's irreversible. And then that's how people end up with, having requiring a surgery, or things like that, you see. So it's always important to stop when you have initial pain and get it investigated and rule out the main reason of concern. Next slide, one. So the whole idea of I think this discussion, I think it's a very nice topic on prevention and its purpose. And I think the purpose here is to do things with a difference and for a bigger difference. And for the bigger difference is basically to lead a good life, make sure we are healthy at all times, although we are involved in different activities, but at all times to ensure that we don't fall into a hole and end up with a problem. Because I think most importantly is health and happiness, and this should be something that we should always maintain throughout the years, right? As we grow older, we want to ensure that we have good joint function, mobility, and most importantly, a pain-free uh, joint and mobility. Next slide, Vanan. So, just a last quote that at the end of the day, health is the real wealth, and it's not the pieces of gold and silver that matter. So in the pursuit of our education, our career, I see many professionals coming with a lot of problems, and sometimes these problems are quite bad in the sense that it really affects their work and their day-to-day uh, lifestyle and their living pattern, so much so they become dependent on painkillers. But I think the whole emphasis here is to understand that a lot of injuries are preventable. All right. So I think we can take the slides off, and I think this is just an introduction to what we want to speak today. And so maybe Vanan, you want to share some thoughts of what you feel about the preventive aspects.
Doctor, the funny thing here right now, I mean, we don't, I mean, we know each other for a couple of years already. You just hosted the show for the past 25 minutes, so you have done the job fantastically. Going through it, I mean, it was very smooth. I mean, this is one of those shows, live shows, that I remain silent because you were just going through the smooth explanation on all the part of the area. But I totally agree with you, doctor, because um, I do see a number of cases where people come to us, even to family members or even friends, that a pain is a sign and a symptom. But I think probably they will not be able to identify the pain, so they always say kneecap pain and back pain. So I mean, for our viewers' purpose, when someone says kneecap pain, doctor, is that a right thing to say? Is a kneecap pain, or but is it related to a lot of other issues? Then probably I will start the gear moving on after that, you explain
Yeah.
better.
So I mean, usually people won't say kneecap pain. They'll say pain in the knee, whether it's in the front or in the side or in the back. Uh, but basically, knee pain in general can mean anything. Sometimes you can also be knee pain, which is a referred pain from the hip. If they're having pain at the back of the knee, it may be coming from the spine. So usually, we would still do a thorough history and take a thorough history, and of course, do a physical examination, and then we will probably get to know what is the most likely problem.
Um, because if even when you look in the concept of the gym, or even like what you mentioned very nicely, Dr. Hitendra, weekend warriors, because probably the weekdays they are very busy with work. Probably it's not an excuse, but that is the actual thing, right? Because people
Right.
are faced with targets and deadlines and working longer hours than ever before. But when they got the opportunity to work out during the weekends, they tend to push a little bit more than ever. They're trying to compensate, but I think that's where the problem comes in, and I totally have to inline and agree with you that when you start to push the body to a certain extent, I'm talking
Right.
in the aspect of muscle skeletal and musculoskeletal area, but
Right.
something can happen. Either the muscle can just muscle tear, or maybe it's an ACL problem or PCL problem, posterior cruciate ligament tear or anterior cruciate ligament tear. But I think for the particular individual who want to exercise, I think it's very crucial, like what Dr. Hitendra has said, that you need to listen to the body, and you really need to do a lot of other stuff like preparation of the exercise, especially warm up, and make sure you know what you are doing. Because if you do not know what you're going to do for an exercise program, if you don't have a plan, then probably an injury is on the way. But doctor, I do believe as well that if it's someone who joins the gym and just going in and then trying to do everything and anything, he put himself into a lot of danger. So it's always good to go with someone who is like a buddy, or if you know that someone is a trainer, you can ask them for advices. There are tons of trainers who are very, very friendly and able to help them out. But I think it's very important of staying safe. But I do see often the people who, and individually people who goes into the gym, they
Yeah.
do certain things that is very off the guard, because I think that it's a possibility of an injury,
Right.
especially in the last repetition when they try to push when there's not much of supporter and they try to push. I can see, it's like, probably I'm training and they are doing it. There's a high chances of risk. But could we say that is it because that I want to push the extra rep, that I want to do a squat, I want to push the chest press and pushing my body and not listening to the central nervous system, which are trying to keep me safe in the aspect of pain, sensation, tired, exhaustion, energy. If I go beyond that, doctor, do you think that will be an injury that is sure to happen or might happen?
Yeah, I think it might happen because if you're already feeling the pull or you're feeling uneasy, if you push yourself, and that's where you can get a sudden tear or injury. I mean, I've seen a lot of people with hamstring tears, calf muscle tear, just out of doing something all of a sudden on the field, especially when they're not prepared for that. Uh, and then they get a muscle pull. So, for example, if your muscles are stiff and then you suddenly get into the field and play for a couple of hours and you play suddenly very vigorously, so that's when your calf muscles, for example, they can get a tear because of a sudden pull. Of course, there may be other underlying issues like if you have some degeneration, but I'm just saying in people who are otherwise healthy, uh, then this can sometimes happen.
Thank you, doctor. Thank you for that. We have a question that just came in, but I think Dr. Itendra has already said that. Pramila has asked, knee pain due to overweight. So probably your concern is she might be relating to, is it because of the weight gain that actually causes the bearing or more pressure, even a 2 kg or 3 kg is extra, means that I'm standing for 8 hours with a 3 kg. Is there a possibility of creating a pressure on the knees, doctor? That's a question that she asked.
Yeah, so I think yeah, you see the thing is the knees are load bearing joints. So just like the ankle and the hip. So whenever you have a lot of load on uh, the knee has to take all the stress. And when you're walking, basically, there are times where both your legs are on the ground. Then when you step forward, this one leg is on the ground, and then two legs are on the ground again. Then again, the right leg is on the ground. So there are times where the whole body weight falls on one leg. Now, if your knee joint is already arthritic, that means the surfaces in the knee joint, they are not as healthy as how they should be. Meaning that uh, if you tend to put too much of load, it's going to cause pain because it just can't take the load. So you can't change the arthritis because that has happened due to wear and tear over the years. But if you reduce the load on the knee by reducing weight, you'll find that the pain gets better because the load is less. Similarly, if you try and walk with a walking frame, you'll find that each step you take forward, you're actually putting a lot of weight on the walking frame. So your weight is again diluted. Therefore, you'll find it's less painful. That is why in people who have arthritis, we often advise them if you want to exercise and you are having a lot of pain in the knee, and let's say you're not a surgical candidate, you're not getting anything done, or you're not uh, in such a state where you need any kind of intervention, just reducing weight, offloading the knee will help you a lot. And instead of running and trying to do exercise on the land, if you walk in water or you swim, your load to the knees are again less because in the water, because of buoyancy, your weight is reduced. The amount of impact on your knee becomes less. Therefore, you find it's less painful.
Totally agree with you,
So,
Doctor. The aqua, right? I mean, I'm sure you're referring
yes,
to aqua.
yes, correct.
All
So
right. So, yeah.
this is a way of managing pain, and of course, if the load is constantly very high, then you're also making the knee deteriorate further. So if you have malarthritis, and let's say you are overweight, and you have a lifestyle where you keep doing a lot of aerobics and running, then you're pounding a lot of weight on the knee. And with time, if you don't address the weight issue and you don't modify your lifestyle, then over the years, because of repetitive loads on the knee, you're going to make the mild arthritis become severe. And then when you end up to a severe state, that's when people have a lot of bow-leggedness. They can't bend their knee, they lose their mobility, they become dependent on painkillers, and then you end up with the requirement of knee replacement surgery. So the idea here is to prevent ending up in such a situation. These are the things you can do. This is just an example of a knee problem.
We have a next question, Doctor. So we can take that. It's came from Sujata. Is it true that women after menopause faces more issue with the bone as it causes menopause? It affects the bone.
Yeah, so because of the hormonal changes, you may be at a high risk of developing osteopenia and osteoporosis. So it's important to look into these aspects. That's why to strengthen bone, you should always do some kind of regular exercises. And of course, premenopausal, it's always important to ensure that your calcium levels are optimized. And also, many of us may have low vitamin D. Again, this is something often overlooked, and if you screen yourself, you may find that you may be having low vitamin D, and then you should take supplements to build up adequate amounts of vitamin D and calcium. This is very important in the bone metabolism.
Thank you, Doctor. Thank you, Sujata, for that question. So I hope that has been answered. We have also have a one viewer who also asked us question. Can all injuries like arm fractures will become an issue later in the years?
Yes and no, because it depends whether the fracture is united uh, correctly or not. That's one. Uh, Number two is whether the fracture in the particular region of the arm was it involving the joint or not. If it's an extra articular, meaning that a fracture is not involving the joint, then it's not going to affect the joint surfaces. It may just affect the length or the rotation of the particular bone. But if the fracture is involving the joint, then there may be a risk of developing arthritis in that particular joint later on, especially if the articular surface is quite badly damaged as a result of the fracture and the joint is incongruent. Then when the two surfaces keep gliding over the years because it's incongruent, this can then lead on to arthritis. It's basically a friction, you see, because if two surfaces are smooth, then it's fine. But if one surface is smooth, the other one is rough, then due to chronic friction, you can get arthritis. So if it's not a joint, then uh, it may be in the metaphysis or the shaft region. Then again, you have to basically have a look at the x-ray and see how much of deformity there is. If there's no deformity, then it's very unlikely that you will have a problem later. But if there is some deformity, then you may have a bit of muscle contracture, shortening. It can affect the corresponding joints.
Thank you, Doctor. Thank you, Deepam, for the question. I'm sure Dr. Hitendra Doshi has answered that. So, Doctor, next is, of course, we are going to do a group discussion right now. I mean, of if any viewers who want to please ask us questions, so please, it's actually more related to the gym stuff. Nowadays, we do see youngsters who are coming up, taking up bodybuilding as a part of an hobby, a part of a career, and also for those who are going as a gym goers, right? They want to look good, all right, and aesthetic. You want to have an aesthetic body, but we know the vertebrae of the spine, the S cos, for our balancing and so forth. So especially one who is doing a squat. I mean, if he's been doing it gradually and increasing the weight, that's perfectly fine. But if someone who does a sudden jump, all right, monkey see, monkey do. He's doing 30 kg. I probably want to do a 50 kg. A little bit of ego, a little bit of pride. I go in, I put on the weight, and I start doing squats, which I've never done, or probably lack of experiences and postures. Knees are always out from the toes, not in a great posture. What is happening on the vertebrae, doctor? I mean, what is the long run? Because sometimes when you tell them, they don't listen, right? Because they say, hey, you know what, I'm boosting my ego. So sometimes it's a question of either ego versus the amount of weight that I can carry and beneficial. There's always a bit contradicting here because we do see this happening in some gyms, not every gyms, but possibility an injury is happening when we look at the anatomical of the human body.
Yeah, so basically, in the spine, there are two aspects. One is, of course, a disc, which is a shock absorber. You have it in your cervical spine, your thoracic, your lumbar spine. And of course, the other aspect is the joint between each vertebrae. So both of these things can be affected. Now, when you do a lot of loading, of course, it can affect the disc. With age, sometimes you can get a bit of disc desiccation, where the disc becomes a little dry. You can have a problem of a disc prolapse, which can then impinge your nerve and cause nerve problems. Of course, again, there are other risk factors for this besides gymming itself, carrying weights, your own body weight, smoking, past history of injury to the neck. All these are risk factors, right? And of course, as far as the joints are concerned, again, the joints can develop arthritis. And typically, you may realize many people have issue of cervical spondylosis or lumbar spondylosis, which simply means there's already a certain amount of degenerative changes going on in the spine. So when you go and do like a headstand or you carry a heavy weight, then you're stressing the neck more, and this can cause a lot of chronic problem. Okay, so my advice would be that if you're already having some amount of neck pain, get it checked first to see what is the reason. Uh, if there are truly these issues which are pre-existing, then it may not be very wise to go and carry a lot of heavy weights, because this can make it worse, especially if your muscles, your core muscles, are not built up properly and you try to carry heavy weights. That's when sometimes people get a sudden disc prolapse, and then they get into trouble because of a some nerve root impingement, and they get terrible shooting pain down the legs. So all these things again do happen, but I think they're always preventable. So if someone's going to the gym and they're increasing the weights, week after week, the moment they feel a bit of discomfort, or they feel it's a bit too much for their back, don't push yourself, because the last thing you want is some kind of injury, and then you end up in a bigger problem.
Well said, doctor. I mean, the word here is progression, and slowly you increase it up. And if you, I mean, for those who are going to work out, I think it's very important. It's not just going and loading weights and then doing it instantly overnight. You have to listen to the body. If there's pain and symptoms, you always need to understand what is it all about. As we talk about this, doctor, we have many questions that's coming in. Thank you so much, viewers. But I'm going to take this question first before I go to the long one that is lined up for us. This is by Sharon Joseph. Thank you, Sharon, for posting these questions. I hope you're still online. If you do, please share the video so that your friends also can be seeing this as well at the same time. So she asks us, doctor, hi doc, a quick question. Any supplements recommended for knee pain? Example like collagen?
Okay, so this is a common question many people ask. I think there is no harm taking, but there is no proven record to show that this will reverse the pre-existing arthritis that one is having. Uh, it doesn't mean that if you take collagen or glucosamine, your knees are going to be the knees you had when you were in your 20s. That's uh, not true. Okay, but many of these glucosamine or collagen capsules that you may buy from the shelves, they also contain other kind of products like MSM, for example, which are actually anti-inflammatory, but they are more natural products which give anti-inflammatory effects. So it helps you with the pain to a certain extent. It may reduce the inflammation. So my honest advice is anyone who's taking these supplements, if it's helping you, continue taking, because it's not going to cause any harm. Uh, but if it's not really helping you, then uh, don't take it. Uh, but whether it has any consequential effect to the knee arthritis, uh, the answer is no, because it doesn't reverse the problem that you have.
Thank you, doctor. Thank you for that. I hope
But
that.
having said that, if your other joints are, healthy and they don't have any pre-existing problem, of course, these supplements will help nourish the cartilage, and maybe to a certain extent, it can prevent other problems in other joints.
Thank you, doctor. Thank you for that. We have another question from Siva Kami. It's quite a long question here. I was diagnosed with rheumatoid arthritis since age 24. Not on any doctor follow up. Previously, yes, but most medication causes nausea and steroids and its side effects. What's your advice? Is medication necessary or change of lifestyle is enough? Two, at the moment, I don't carry much weight, even when marketing will cause inflammation. But a gymming or carrying weight recommended. Will it strengthen the muscles?
Yeah, I think you should probably go and see a rheumatologist and get it investigated.
Thank you, doctor. So that was the answer, Shiva Kami. So I think, like what doctor said, you need to go and check it out, because if it's in a condition, you really need to see what is the next course of action and what is the limitation that we are going to talk about, right? Not to do something that is extreme and then getting more injured itself. But doctor, again, in your expertise, ACL or PCL, I mean anterior cruciate ligament tear, which has happened in the front part of the knee, PCL, posterior cruciate ligament tear at the back part of the knee. Which one has happened the most often, doctor? Is it because of certain sports that we play that off of the posture that often these ligament just goes off in two
Yeah,
pieces? What is the symptoms? Why is it
yeah.
happening?
So most commonly it's ACL, because whenever someone is involved in a high level kind of a pivoting force to the knee, that can lead on to when the knee pivots, it can cause a lot of strain to the ACL, and that's how sometimes the ACL will rupture. Sometimes you get a partial tear, and of course, if it's quite a significant force, you can get a complete tear.
Okay. And it often requires surgery or
Well, uh, well, it again depends on the age of the person and whether he's got any other pre-existing medical problems. But most of the time, if he's a young person with a complete ACL tear, most of the time surgery would be recommended because it is important to give stability back to the knee. Because if the knee is deficient of the ACL, then it's going to be very unstable, the knee. And in that phase of instability, other structures of the knee can get damaged. For example, your meniscus, you can develop arthritis. Therefore, in a young person who's going to be using his knee, loading the knee, uh, it's best to ensure that the stability is restored. And that can only be done through a surgical procedure. But then again, I think here we are talking about prevention. So I think the most important thing is to prevent an injury. So if you're in a high level kind of pivoting sport, sometimes if your muscles are not strong enough, then you can succumb to injury. Uh, and if you feel that your knee is a little weak, there's no harm using a brace when you're playing that sport, so that you can prevent undue rotationary forces, and it's probably going to help prevent injuries. Of course, accidents happen in a sports field. That is something you may not be able to prevent to a certain extent, because if someone accidentally dribbles a ball and you know pushes you in a rugby, for example, and you happen to fall, then of course that's not preventable to a certain extent. But of course, to a great extent, there are many things we can do to prevent these problems.
thank you, doctor, for that injured cruciate ligament tear. Yes, more viewers are just coming in. Thank you so much for joining us today. We are talking about the prevention and purpose. Today with me is Dr. Hitendra K. Doshi, a specialized orthopedic surgeon from HK Doshi Orthopaedic Center. Um, Doctor, you just opened up your third clinic in Mount Alvernia. So how are you managing it in terms of different locations? And what is there a lot of cases that pertaining to the bone structures nowadays? Is it because
Uh,
I do see a lot of youngsters nowadays having pains as well in the knees. So
yeah,
pain is
no,
winter.
true. So no, basically it's just different parts of Singapore. So one is in the Orchard area, which is Gleneagles, and the other one is in the east, and one more is more centrally located at Alvernia. So it's more for convenience of patients if they need to come for a follow up. It's easier for uh, them to have a review. So therefore, I just alternate in different days, different timings at different places.
Thank you, Doctor. Doctor, we have been for almost about 48 minutes. We will just have another few more minutes if we have any more questions. So, viewers, if you do have any more questions, can you please ask us. Dr. Hitendra is here. I mean, is this
Okay.
the second time
So,
for us? Yeah.
so maybe I'll ask you a question.
You are taking over my role, Doctor. Come on.
Right. So I think you see many people are going to the gym, as what you said,
Yeah.
and many of
Correct.
them do get injuries while gymming, right?
Yes.
Many of them also doing a lot of high intensity activities at home, especially now with the lockdown. Many people are now have changed their passion of certain particular sports. So as a fitness coach, maybe you want to share with us. What are the preventive techniques that you would normally share with your clients, or even with all the viewers who are online today? What are the tips that you would like to share? Because I think a lot of this preventive awareness uh, can equally be imparted from people like yourself, because you're the frontliners who are actually seeing them and training them. And so maybe you want to just share with us, when a client first comes to you, they want to get into some kind of gym workout. What are the salient points that you would normally advise?
I think that was a very interesting question, Doctor, because today you are definitely doing the host job here. You know, I'm actually quite speechless. We have to meet up for coffee very soon. But being in the gym for almost 18 years, after that, which of course I started my own, there's a huge difference in between that. Gym is very just focused area, right? I mean, you come in, you do the stuff, and then you go. But being in the gym for almost 18 years, I have now moved on out from the gym. So, which normally we do everything in the outdoor using the nature, the parks, the chairs, the tables, and whatever that we see. But there's no one answer to it. We do also need the gym to promote muscle growth. But, in the same time, we also need a very holistic approach, which means in the nature, where, you climb up a mountain or you climb up the stairs and you tend to be in the among the forests or the trees in the national parks. But what I do notice that in the gym itself, sometimes the ego develops. It's always about who is getting heavier. Sometimes even if it's another party just standing beside, if I'm doing a 20 kg, probably you'll carry a 30 kg. I don't know why is that. It always happens in most of the time in the gym, but I think that has been changed. People do understand that injury do happen in a form of any angle, right? Sometimes after you're doing a very heavy weights, probably you can't even lift up, and then you start to go and slam the weights in the rack. You probably just hurt your fingers. I've seen many accidents pertaining to that, right? One guy who dropped the dumbbells onto his toes and his toes got smashed. One another chap was doing a weight training and then he just slammed the weight, and in between the metal bar and the thumb just went in. So I think one should understand the parameters and the safety aspect of listening to your body. I think most injury happens, the way I observe, is because you don't listening it to your body. You should know when you're doing a 10 repetition. Why? If you look at some personal trainers, they are very focused in their number of repetitions. It's not just a number where we say, oh, do an 8 repetition. It's not just a number. It's about your performance. It's about how much can you carry for the duration. So we always measure in these two numbers, duration versus intensity. If the session is going to be 1 hour, the intensity have to be lower. But what happens if the intensity goes up? Which means the body is under an extreme load, and that actually causes a lot of injuries, possibility injuries. Because if I'm just going without a repetition, and when I start to do a squats, even just with body weights, and your ACL can just snap off because so much of pressure is on your ligaments rather than your muscles. Your quadricep have 4 muscles, your hamstring has 3 muscles. You got a very good calf muscles, but the muscles are not working because of your posture is off. Your knees take the pressure, your ligaments take the pressure. So anything can happen from that. So sometimes when I walk into the gym nowadays, when I look at someone who's training, I mean, sometimes they don't listen. They just want to do what they want. So you just leave them alone. But the chances of what's going to happen in the next 15 seconds or the next 1 minute, I can anticipate that by looking at the posture, looking at their breathing, looking at their way of handling things. You can actually anticipate what is going to happen. So the anticipation is very necessary for those who are going to the gym. You need to do a proper warm-up. You need to go through a proper training program. If you do not know how to train, it is not just you Google and you go. No, I mean, information's all out there, but you need to go with a buddy. You need to go with someone, or you ask information to make sure that you perform the exercise safely. The injury happens when you don't have a guide, when you don't have a map, and you're not sure what you're going to do. And that's where a lot of injuries has happened. I'd like to share an experience which I saw personally. There was one point of time where I was conducting a training. This gentleman was doing a back row. So I was training, right? He was doing a back row. And we always go by sets. We take rest periods. We do check times and so forth. But doctor, at the back of me, there's one guy who was doing a chest press. All right. And of course, as usual, all kind of scream, can be heard. So when I look at him, his posture is out, right? In versus his clavicle and his nipple line, the bar is not his nipple line, he's doing halfway, and I can see, because I was so concerned on my particular client that was training, and then another guy who came to that guy, say, oh, come, let me spot you. So probably he doesn't have that experience, and because he can't push anymore, because this guy doesn't know his strength and weaknesses, he said another two more. So that guy was completely exhausted, and he started to push one, and another last one he pushed him, he dislocated his elbow joint because he heard a scream, and he got to hold the bar, and then we got to rush him to hospital. So injuries can come in any form. It's very dangerous. Impingement of nerve is also a very common thing that I have seen in my years of experiences. When someone does squats, very heavy weights, and didn't do with a proper guideline. When I'm talking about people who just came to the gym without a proper guide or without a proper experiences, that actually causes the pain. So you must be anticipating what's going to happen the next 30 seconds, or am I going to take a rest? So it is a big, like a competition. You got to write your competition, what's going to happen, what is going to do, how is your warm up, why is warm down. It's all very necessary. But nowadays you don't see that. People just who come to the gym, they just jump on and then start exercising. So that is where all the injuries will happen. In my years of career, when I lecture or when I was conducting trainings for the trainers for certifications, the most important element, it's very important, is about your safety aspect. I mean, of course, there's other aspects to it, but if there's no safety, then you're putting yourself into injuries. And if there's going to be an injury, sometimes you can even prevent them from coming to the gym. So I think when you go into the gym, you need to have the safety sense and the safety aspect all the time, doctor. I think that is very crucial. Will you agree with me there, doctor?
Yes, definitely.
So if I answered your
Yes, yes, definitely,
question.
definitely. Yeah. So I think the key point again is, as what you said, you should anticipate problems, and when you anticipate, you can then prevent them with a conscious awareness.
Thank you, doctor. Doctor, can I ask you a question?
Sure.
You know, fracture is very fragile for elderly, especially their 50s and 60s. That's why we call it fall preventions and very
Correct.
careful. But of course, when the fracture happens for someone who's 70, 75, I mean, most of the time it's bone brittles that actually causes the thing. Um, is there a particular reason as we age, can we do reverse aging as well? We know that resistant exercises, to a certain point, of course, exercises does have benefits to your bone, your skeletal muscles as well, as supporting joint structure. Is there a thing that exercise, I mean, of course proven, but what is your take in
Correct.
that?
Yeah. So I think, talking about elderlies, I think this is something again, is on a rising trend around the world. You see more and more fragility fractures, and I think this again, to a large extent, is preventable. Right now, there are two things here. One is, as you age, your bone may be becoming more brittle. That's what we call osteopenia and osteoporosis. So for that, if you have adequate awareness and you start intervention early by building up good amounts of calcium, vitamin D, doing a lot of regular exercises, and if you're really osteopenic or osteoporotic, you may need to get medicated to, build up your bone strength. So you're looking after one part, which is to prevent bone fragility, to prevent brittleness. Now, the other aspect is injury prevention. So, in the elderly people, what we every time try to advise, not only to the elderly, but also to the caregivers, to their kids, or to their helpers, is fall prevention. So, again, as one ages, they are more likely to succumb to a fall because of many reasons. One is their hearing may not be very good, their sight is not as good as how it should be when they were younger, their reflexes, the ability to avoid something coming on in front of them or something coming in the way, may not be as good, as swift as how it should be, because they're just getting older. So therefore, you have to ensure that you prevent a fall in all possible ways, making sure the home environment is good. You have anti-slip mats. If they're going to the washroom, there are rail bars for them to get up, to hold on, adequate lighting. So these are all very relevant, preventable aspects that we should all practice. For example, if an elderly is going to the market every day, just to buy some groceries, if it happens to be a rainy day and you know that it's going to be all wet, it's best to avoid that particular day, because you are just making yourself more vulnerable to injuries. Because it may not be you, but it may be somebody who's in a rush, may accidentally hit you from the back and you fall down. And when you fall, because you have brittle bones, then you succumb to a fracture. So it's very common to see many people getting wrist fractures, hip fractures, all due to injuries which are most often preventable. And of course, they have underlying osteoporosis, which is again something which is preventable. So I think a lot of issues here are indeed preventable, but it is awareness that it's probably lacking, and probably some of us take it a little lightly. But I think we should all take it more seriously, so that we don't succumb to issues where we need hospitalization, we need surgery, etc.
Thank you, doctor. We have another two more questions, and after which I think we will end the session. So these two questions are just short one. I have one from Rina. Recently, I have suffered from a knee pain after a leg press training when I took medication with the consultation of an orthopedic doctor. The side effects are swelling on face and ankles. What may be the reasons?
Yeah, I think it's best to go back to the doctor and check, because sometimes medications can cause some allergic reactions.
Okay, Rina, that was the answer by doctor. Thank you. So we have last one more question, doctor. Then we can summarize it and then we can finish it up. We have Dr. Diraj here. How often should one perform bone mineral density scan?
Right. Thank you, Dheeraj, for the question. I think basically, if you are diagnosed to have osteoporosis and you're on medication, then I would normally repeat a scan every 2 years to see whether you are responding to the particular medication, right? But I think if you don't have any symptoms and your vitamin D and calcium is quite normal, uh, you don't have any history of a fracture, then I wouldn't uh, routinely request for that bone density test. But nevertheless, if there are some suggestion that uh, you had a fracture, for example, and you have some risk factors for osteoporosis, for example, you are perimenopausal or postmenopausal, uh, then of course it may be indicated to get a bone density test done to ascertain whether you're osteopenic or osteoporotic. So I think if you're osteopenic again, then there is no real need to repeat it um, so frequently. But if, of course, if you're osteoporotic and you are on medication to treat the osteoporosis, then you should repeat a scan. And I think 2 year interval is probably something that I would recommend.
Thank you, doctor. Thank you, Diraj, for that question. Doctor, we come to the end of the session as well because we are almost at 1 hour and 4 minutes. But Rina has said a thanks to you. Thank you, doctor. Thank you, Vance. Thank you so much, Rina. So, doctor, last question for you, and then one last question for myself. I'm going to ask you first, after which you can be kind to me, ask a very small question, not long. All right, I'll leave it to you. All right. So this question is from me. Are bones alive? Of course, they are just bones. The bone. When we say bones, people only remember about that skeleton. And the dark. Just coming like that. But it's more to it. It's a mineral. It's a living organism, and so forth. So what is your think about that?
Of course, it's a dynamic structure. It's always forming new bone and taking out old bone, and it's always remodeling. So of course, it's alive, and in fact, it's giving us life. It's giving us structure. It's giving us posture. It's giving us the ability to move from one point to another. So bones are actually, I would look at it the reverse, that it is giving us life. It's giving us mobility. It's allowing us to move from one point to another. So I think it is something that we should not neglect, uh, whether it's a bone or a joint. A joint basically made up of two ends of a bone, right? So these are again very, very important, the joint and the bone itself, because this is what's going to keep us active in our golden years, and it ensures good mobility. And at the end of the day, all we want is to be happy. And anyone who's in pain and who's suffering is not going to be a happy person. So I think with all these preventive thoughts, I think putting it into practice would be the next step forward, so that we can have a healthy and happy life.
Thank you, doctor. So that was my question to you. So
Right.
your last question to me, and then we
Okay.
can summarize it. You're
So,
going to do the closing for this talk show. So yeah,
so my question to you is, Vance. I
yeah.
think maybe I think you've been very inspirational to many of us, including myself, because I have seen many of your talks and you've interviewed many people. And I think uh, the question I'd like to ask you is, what has inspired you to basically host such a show where you're actually allowing many people to gain a lot of awareness and knowledge, which I think you are really contributing something very significant. So tell me, what is your inspiration, so that it'll probably inspire all of us too.
Well, thank you, doctor, for that question. I mean, it's a bit more on the softer side, but I will of course, I will answer that. It's been almost a year since Kopi with Vets has started. I mean, it's during the pandemic, when things everything get very slow. All things was changed overnight. People going to the office, stayed at home, people gathering, socializing, everything is turned around. I think there was a very valuable lesson for every one of us. I think that kind of lesson, we might not have learned that if this pandemic never came true with us. But sometimes, some cases are really sad where they lost their loved ones and so on and so forth. But I do see a significant increase. I got to say, people going through anxiety, people going through depression, people going through mental related issues. But at the same time, we are also another set of problems which people are gaining weight unnecessarily because of the stress they are going through. A lot of stress eating, binge eating, and also violences also has increased up because never before, we stayed at home for so long and so enclosed, with curfews. Not really curfews, but Singapore managed it very, very well, especially other countries as well. But Singapore, people are very obedient in rules and regulations they follow. But I think there was a very huge amount of issues that I foresee and I already seen, and most of us seen. And to keep myself more productive at the same time to be value to what I actually do in my daily life. And that is where I was discussing with my other half, and I said there must be something can be done. I will never take a no for an answer. I mean, that's basically what I practice right now. If someone says that's tough to do it, then I say let's do it. If someone says that's challenging, then I say let's explore it. So giving up is not an option. There's always another way to do it. And I wanted to reach to audience. I want to reach to all my Facebook friends. I mean, at this point of time, this is the best platform. As we all can see that in social media, we do see negative thoughts. I mean, it's not that they want to, but sometimes they want to express their feeling, express their thoughts. So that was actually one of the channel they was releasing it out. But when Kopi event started, it was just basically a few shows. I remember I was doing it with you. Dr. Hitendra, and that was just maybe the first 10 or the first 15. And the first show that started is just to inspire and to get experts like yourself and many other doctors who came on board, to give their views and to get a connection. And this connectivity actually explored even further, because now people can just sit at their home, some actually watching and seeing it, some are lying down with their posters and blanket on and they're watching it because it's a late show. And doctors is on board, Vance is on board, and I mean, where can you get this, right? I mean, it's pure information, right? And they can ask us questions, and there's no catch. It's very direct, and the show has been going very well. And I don't intend to stop, but rather I got to say that it's been explored to a different level. This is our second year, and I have a very very small team, only myself and my wife and my other, and my another friend. So Kopi Events just started with myself, and now we grew up. But I think there's more to explore.
Good. Thank you, Vance, and thank you for this kind invitation. And hope uh, the message lives on, and we all become healthier and happier people.
Thank you,
Thank you.
Doctor. And you have completed that the last part of the closing. Okay, so we got to meet up for coffee soon. All right. So let me know.
Yes.
I have a viewer who just messaged me. All right. You want to hear that what she has said, but I'm not going to say the names. Yeah. Yes, on bed with bolster covers and blanket on. I just told you, right? You see, it's not a joke. So people are enjoying it. So yeah. So we will come back again next time for a better topic on a better exploration, Doctor. Thank you so much. We will take it up on our next session.
Thank you. Good night.
Thank you. Thank you for your time.
Good night.
Good night. So there goes the show for almost about 1 hour, 12 minutes. Thank you so much. And I know more people are just coming in right now. And I see a few questions that's already coming up as well. Unfortunately, the session is being ended. But if you do have any questions, just keep on messaging. I mean, on our Facebook as well. And I'll try to get these questions answered by Dr. Hitendra. And he's always busy with his surgeries and his work and so on and so forth. But I will try to get it done. But again, coming back, bone health is very important. And we covered a lot of stuff in terms of prevention, in terms of medication. Of course, when it comes to medication, it's very crucial. It's very sensitive because it always go best to go to your own doctors to clarify if you have a swelling, and like what Dr. Hitendra said, it's better to understand that. But in a whole picture itself, I think bone strength is very important. The amount of nutrition that we need to take, that's also very important. There will be more exciting talks that's coming up, lined up for the next 1 month already, where we have different speakers coming on board, different expertise coming on board to talk about deficiency on iron, deficiency on protein, and even minerals and so much of vitamins in our body. But I always say this in my talk show, our body is like a special gift where you can't change spare parts. Right? It's not a car. You buy a car and you say, I send for servicing. Even our body also needs servicing. You're going to need to go and see a doctor for a monthly or 3 months once, for a medical checkup, yearly medical insurance checkups and so on and so forth. But I think most of us fail to understand how this mechanism works. I think that is very, very important. We need to turn inwards. I think most of the time you're always turning outwards and going around things and going after the dollar signs and doing things that sometimes not be unproductive, if you think that it's productive. And we're spending so much of time on every other thing, but we fail to spend time with us. And for those who my clients and my friends and family members, I always tell, it's very important. Your mind, your body, your bones, every other things that we talked about over the past 1 year. And in the month of April, we have celebrated our first year with Kopi Events, and I'm very honored and pleasured with all your support, with all your comments, with all your suggestions. I know the messages are keep on coming in, and thank you so much. And I try to answer them and come up with topics. So if there's a topic that you always want us to talk, I'm more than happy to bring in the experts. We have a very good network of doctors and speakers at this point in time. So we are exploring into the next level of bringing this show to greater heights with lots of members and viewers in Facebook supports. So thank you so much as usual. If you do have any question, just keep them coming up. I'll try to take it as much as possible. All right. Thank you once again for joining me at Kopi with Vets. All right. But the thing is, past few days, past few, 2 weeks, yeah, it's been water because the sun is just explosive, right? It's just scorching hot. So we need to drink lots of water. Probably next week, not probably, we are catching next week with a different topic. As usual, the posters will be out in our social media. Please watch it and then join us 10 p.m. on Wednesday with Kopi with Friends. For now, signing off. Ciao. Bye bye.